Hello everybody, today we're visiting our friends here at South Texas Bone and Joint, our trusted advisors for orthopedic surgery. And today I'm here with Dr. J.C. DeLeon to learn a little bit about him and what he does here at South Texas Bone and Joint. So it's so great to be here with you today.
Oh yeah, thank you for having me.
Of course, you're fairly new to the Corpus Christi area. Talk to me about where you came from and what brought you down here.
So I originally am from Lubbock, Texas, but I spent about 9 years in San Antonio doing my medical school and residency. And then I spent a year doing orthopedic trauma in Denver, and then I came here after that. So that was in September of 2023.
Okay, and why the Coastal Bend?
So, I mean, first, my wife is from the Coastal Bend, so that brought me down here. But, you know, having been so close during my training, this is a pretty underserved area, and I thought it was a good opportunity for me doing orthopedic trauma to build a trauma program in this region.
Very good. Okay, so you've already given us a little bit about where you spent your time and educated yourself. Talk to me a little bit about your fellowship and what you specialize in.
And so I specialize in orthopedic trauma, which is a fancy way of saying I fix pretty much anything that's broken, essentially from the hand all the way down through the foot. So it can be as small as finger fractures or wrist fractures, but also as big as pelvis or acetabulum fractures, as big as shoulder blade, up in the top of the shoulder at the humerus. So there's not any fracture I can't really take care of for the most part.
Okay, and being here in the Coastal Bend, what are some of the most common fractures that you deal with?
Out in this area is a lot of elderly fractures, so hip fractures, fractures at the top of the shoulder, fractures at the wrist, fractures down at the ankle. But there's also a handful of fractures that don't heal correctly or they don't heal at all, and those are other ones that we can address as well.
Okay, so question, is it possible to experience a fracture and not realize that you have it? And if so, what would the symptoms be as that continues to, I guess, get worse? Yeah,
it's especially common in anybody that has any lower extremity paralysis or any advanced diabetes, but probably some of the common signs of a fracture that is like very subtle or swelling at an area, redness at an area, especially after even a small amount of trauma, banging it on a table, hitting it on a door, any inability to walk after a fall, especially in the elderly, is concerning for a fracture.
So you mentioned some of the things we'll look out for an untreated fracture, but is it possible that a fracture didn't heal properly? And if so, are those the same symptoms that we're looking for?
Yeah, some of them can be similar, although sometimes more challenging to pick up. But if you have a fracture that's been treated, whether it's with a rod or an internal plate or some screws, probably the most common sign of it not healing is persistent swelling or pain at the fracture location. For the most part, as something heals, pain should get better and should go away. But if that pain persists, then that's usually a concern.
Of course, and all the more reason to make sure that you are with a professional in this case and you do come to your follow-up appointments. And of course, we want to encourage you to stop by South Texas Bone and Joint. They have an incredible staff here. Everybody is so well trained and passionate about what they do, which is why they're our trusted advisors in orthopedic surgery. So where can we go for more details?
Yeah, on our website, it has the numbers and locations for us. And our trauma clinic is right across the street from Christus Spohn Hospital. So it's different than this location, but that's where we do all of our trauma.
Very good. Well, it's great getting to know you. Thank you, and welcome to the Coastal Bend.
Yeah, thank you. Appreciate it.